Hey, welcome back everyone to Good Day Tulsa. It's now 20 minutes after 9 o'clock. Well, imagine radiation treatment for the lungs that is so exact it even adjusts to breathing movement. That's just one of the incredible possibilities available at Oklahoma CyberKnife. Dr. Melissa Boersma, and also radiation oncologist, and Dr. Paul Kempe, a cardiovascular surgeon, joining us this morning to talk about CyberKnife. Thank you guys very much for coming today. Certainly appreciate it. Let's talk about CyberKnife first. The technology is absolutely unbelievable, and we've had a number of people come in and talk about it before, and jaw still drops when we hear about how advanced it is.
It's really quite remarkable. It's a way of delivering high doses of radiation therapy to very specific targets and sparing healthy, normal tissue, very close proximity to that.
Now, you guys have been online about a year now, right?
Yes, the Oklahoma CyberKnife went live in July of last year.
Now, this is one of the more advanced and more powerful CyberKnives, I understand, in the world, right?
It's the first installation in the world of what's called the 8.0 unit, meaning that it has a higher energy source. It's able to deliver a very high dose of radiation in a shorter time frame than some of the earlier models. It also has an iris collimator, which is very similar to a camera, so you're able to adjust in real time the size of the beams that you're using to aim at a target, so you can be very conformal and also cut down in the treatment time for patients.
Now, what does this mean for patients? I mean, you talk about that, cutting down time for them. Dr. Kempe, I mean, you were talking about the patients earlier, and we've had patients in before, are just amazed that they can drive themselves away from treatment. And
correct. It doesn't require sedation. It's usually a very short treatment and a relatively small number of treatments compared to conventional radiation therapy, so that patients can complete the course quickly and really with minimal disruption of their lives.
Okay, what kind of patient would be able to use CyberKnife?
Well, there are many types of cancer that can be treated with radiation therapy, and specifically some of the more common cancers such as prostate cancer and lung cancer, which is the thing that I'm most likely to see in my practice, which is the most common cause of fatal cancer in the United States. The thing about CyberKnife is that many patients are not able to be treated completely with surgery, and CyberKnife in many cases can treat those patients who are not candidates for surgery really with much less disruption than a surgical procedure would do.
Okay, and you said earlier, I guess the non-invasive is the first course that you'd prefer over the surgery, right?
I think any patient would prefer not to have me put an incision on their chest. But.
Okay, and what is do doctors recommend that a patient come in and try CyberKnife, or how does that work?
Ideally, a patient would have a tumor that's very well defined. You can see the edges of the target that you're aiming for. But one of the things that's nice about the CyberKnife is that it's actually able to track in real time the movement of the tumor with breathing and respiration. So we can use synchrony, which is a special system with the CyberKnife, or fiducial marker placement, that the image guidance component of our CyberKnife and the the controls, which are robotically inclined, can follow that tumor as the patient is actually laying on the table and breathing.
That's amazing. And we were talking about earlier, as far as patients, none of the side effects that you associate with chemo and that type of treatment.
It's a little bit different. It's a local treatment, so you don't have as many of the systemic, potential complications.
All right. And doctor, do they just, if folks are interested, they see you and you recommend, or how does that work?
It can happen a number of ways. We'll often have a patient referred to us because they have lung cancer to consider various options for treatment. Patients also who are interested can contact us directly at Oklahoma CyberKnife.
Okay, listen, thank you guys very much for coming in. Certainly appreciate it. Oklahoma CyberKnife, 6802 South Olympia Avenue, 71st and Highway 75, 949-6676. You can also go online to Oklahoma.